and welcome into To Your Health. You know, we're very proud to have some great orthopedic surgeons in Montgomery, Alabama. And today I have with me Dr. Lee Murphy, Hughston Clinic.
That's right.
Hughston Clinic is really have a great name. And of course, we're glad to see that you're with the clinic.
Thank you, Jack. It's been a long time for me in Montgomery. I've been in Montgomery a long time, but Hughston Clinic obviously has been a local healthcare provider for many years in Columbus, Georgia, and we kind of brought the Hughston Clinic to Montgomery back in 2020, I guess, 2019, and it's grown from there. So yeah, I've been a part of the Hughston Clinic since then, and it's been a really good experience for me.
Great. Now today we're going to have something, and it's going to be over the next few weeks because these are some long interviews, but Dr. Murphy actually did ACL surgery on 4 members of a family. It's unusual for a couple, and the father and 3 daughters.
That's right. That's right. It's a really rare thing, and they're just a great group of people who really made me look good because they're hardworking and athletic and very motivated. So it was just a fun experience, and I got to follow a couple of them. They would come at the same time to their follow-up appointments, so it was very efficient for me too because they could all come together. We could check on them. But yeah, rare situation, but it does highlight some of the important issues about ACL care that everybody really needs to know about who has kids, grandkids that play sports. It's important to everybody.
Good. So we're going to get into these different segments with Dr. Murphy actually talking to the patients.
I'm here with Marie Downey, a patient that I know and love very much. Marie, you and I met back in 2016, is that right? Tell us about how you injured yourself and what brought you to my office.
Okay, so in 2016, I was in 7th grade, and I had gone to basketball trials. It was the first day of trials, actually, and we're not going to go into the embarrassing moment of how I actually hurt myself, but I ended up tearing my ACL at basketball trials that year.
Yeah, and you were a student at Prattville High School at that time, or junior high school?
Junior high school.
And I remember when we first saw you, you were kind of surprised that someone could tear your ACL at such a young age. Do you remember us talking about that?
I remember everybody, getting the MRI, coming to your office and everything. Everybody was really surprised, like, wow, that's really young.
Also, we know that it's very rare, to have a tear that early, but it also unfortunately exposes your knee to risk over a longer period of time. So you ended up playing sports for a lot longer the rest of your high school career, right?
I did. I played all the way up until my senior year. I did not play soccer my last season of soccer, but I played 3 sports as a freshman and a sophomore, and then 2 sports as a junior, and then just basketball as a senior.
But you still do a lot athletic things. Tell us about what you're up to these days.
Right. So I'm a sophomore at Mississippi State right now, and I'm not playing sports anymore, but I definitely am at the gym as much as class allows.
Sure.
Just staying healthy and
that's awesome.
Keeping the muscle build up.
I'm here with Jael, next on the list of our ACL patients. Jael, we met each other through your sisters, but also you injured yourself, I think, was it at soccer? I might have even been at that game at Montgomery Academy, but I remember you injured your knee, and this was in March of 2023, right?
Yes.
What do you remember about that day? What did it feel like?
As soon as I did it, I knew I had hurt something bad, and I knew it wasn't just anything, but I walked it off and I sat on the thing, but I knew it was going to be bad.
You, like most of your sisters, are very tough, and so I'm not surprised that you kind of wanted to proceed on with your game. But we got an MRI, just like your sisters, and found out you had an ACL tear. How did it make you feel to know that you had an ACL tear, especially since you had some family members with similar problems?
It was sad. I didn't want to be injured, and I didn't want any problems, but I also didn't realize how much it was. I thought it was going to be I thought it was going to be a lot smaller than I thought it was.
Tell us what it felt like, how difficult it was, what were the challenges?
Right after surgery? Right after surgery, I was walking. Well, I had good physical therapists, and I was walking next few days and slowly, but I had a good therapist, full range, full motion. And now I'm still doing physical therapy, but I can run, jump, and do everything. But I'm doing it to get back into sports to play this season.
Well, that was very interesting, and I know
it must interesting.
Like you say, it had to be a pleasure working with that family.
Well, they're a wonderful family, and what's fun now is I see them with their youngest daughter at the games with my daughters, And so I get to see them and check up on them all the time, and they're all very motivated. They're very brilliant. So all of them are very exceptional academically.
Well, thanks for what you're doing to keep local, good professionals in the Montgomery area.
Yes, sir. Well, it's really fun to take care of local people. To be a doctor in your own hometown is really a special thing. To see people at the game, to see them out on the street at the grocery store and them tell you that they appreciate your care, it's just a real blessing, and it makes it really worth it, to be honest with you, because day to day, it's tough. It's tough working very hard as a surgeon. I mean, you sacrifice a lot, but
You do.
seeing people get better is by far and away the best part of our job.
Great. And we'll be right back right after this.